Okay, so I'm working on this assignment of nursing management strategies in Sentinel use in the Sentinel use simulation, and what I've basically come across here in level 2 is a delegation exercise where each nurse is assigned by me, the nurse manager, to a specific patient based on acuity, but also based on progress, which I think can often be the tricky part. And if they're assigned correctly, the patients are satisfied, and if not, they're dissatisfied. As you can see, I scored 10 with two of the nurses correctly assigning them, and only 5 with one of the nurses. Apparently, what this means is if I assign someone with more experience than necessary to a particular patient whose acuity or progress was not necessarily high, they were still satisfied, but if I sent someone who was underqualified, the patient was not satisfied. In this particular case, I got 2/3 of it right, assigning patients appropriately to 2/3. And in terms of how I felt about the assignment, I felt vastly underqualified. I was in med surg for a year as an RN before getting into mostly psych, addictions, corrections, that sort of thing. And that year was probably the most beginner novice year as a nurse that I've ever felt. I entered this a year and a half after graduating nursing school, but I did not feel like an experienced nurse at all. Felt like a complete new grad. And in this case, I was able to see how, in some of these cases, the patient was acute. Obviously, it said acute, and you'd think, well, high acuity gets assigned to the experienced nurse. However, in this particular case, the acuity is not the only thing that matters. If you look here, yes, the patient's acuity was high, but their lab values were within normal limits, and that's probably where I got something wrong in terms of assigning the patient appropriately, and the fact that they were scheduled for discharge today. In this case, I likely assigned it to someone whose acuity was on too high a level, someone whose experience was on too high a level. I assigned the most experienced. In this case, I assigned someone with medium acuity, the 8-year-old child with autism spectrum disorder, who required 15-minute neuro checks, to the high level nurse with the most experience and the most efficiency. However, I didn't look at the fact that that they had received their drug with good effect, and they really weren't unstable at this moment. And that's, again, what probably got me, because I assigned it to a high acuity nurse. If you continue here, the high acuity patient who was waiting for discharge, I'd assigned to someone who with the least experience and least efficiency, and that's probably was a mistake, because there was a lot of teaching necessary. Obviously, as we go on here, there were some I got right. Obviously, the key things to watch for in this case, and what I really have to look at is, does the nurse have enough experience to provide appropriate teaching? Are they having to administer a lot of IVs or blood transfusions? Do they have to deal with unstable vital signs or unstable counts, lab counts, and interpret them as such? And so overall, in this case, and I'm just making sure I have all my I's dotted and my T's crossed, found this to be a difficult assignment. I certainly learned something through my med surg practice, but I think more than anything, I really need to focus on interpreting data and making sure that that I look into all the teaching and interpretation that's required of the nurse when making these decisions. In terms of the teaching itself, perhaps I should look at myself, a mid-level nurse who has about 6 years of experience, isn't always the most efficient, but has some practice under their belt, and equate myself to, let's say, Randy, and ask myself in each situation, do I know this, or can I figure out quickly with research? Do I need help? And of course, am I capable and competent of providing such teaching? So that's what I've learned around here. I certainly think in being that I'm likely to enter management soon at this point, I have a positive reference from my travel nurse supervisor at this point. I will be entering correctional nurse management, not hospital-based med-surg bedside nurse management. But this is all data that I can certainly apply, especially in terms of vital signs, lab counts, and interpretation, decision making. The list goes on. So good project, yeah. And that's my report. Thank you.